The team, happy birthday. My name's Ben and let's talk the modified 4 frames assessment for paramedics. For high acuity jobs, we've got the acronym SAMPLE, which isn't a recipe for how to take an assessment, but it's like a checklist at the end to make sure we've nailed the key points. Signs and symptoms, allergies, medications, past medical history, last ins and outs, and the events prior. So again, it's a checklist at the end to make sure we've got our key points. But if our patient is more low acuity and we've got more time to spend, then we can do a more thorough assessment, and for this we'll use the modified 4 frames. So let's start with 1. So our first frame is the history of their presenting complaint. What do we want to know? So we start generally and we ask, why you called the ambulance today? What's wrong? How can we help? Then, once we've got the presenting complaint, we're going to go and use the Naylor Timeline Approach. So, what's happening right now? What's wrong now? And then, for how long have you been feeling this way? Then going back, how were you yesterday, last week, and for the past few months? So, getting a progression. Then, for our symptoms, we can use the mnemonic SOCATE to guide us through what we want to ask. And if there's pain, we can use our OPQRST mnemonic. Then, once we've got some information, we can dive into that relevant system. For example, our cardiovascular or our respiratory system, our neurological system, and go through and do that assessment. We're going to follow an expose, look, listen, feel. And during this time, we're also going to collect our vital signs. Then we're going to look through our red flags and a system review of what other systems might be causing the problem. Frame 1. Then, moving on to our next frame, we've got our medical frame, asking about past medical history, any medications that they're taking, including recreational ones, and then we want to look at their compliance, so have they been taking them, and also any changes to their medication, and then allergies. Then our next frame is the social and family history. So does their family have a history of medical problems, and what are they? Could they be related to how our patient is presenting now? And then for social history, we want to look into their smoking and alcohol intake, and also their smoking and alcohol history, their living and working situation, and their activities of daily living. Are they independent with their activities of daily living? Do they require assistance? And what does their typical day look like? Then, to round it out, we've got our ICE, so ideas, concerns, expectations. So ideas, ask the patient, what do you think is going on? And then concerns, what are you worried about? What are you concerned about? And then expectations, how can we help? And what would you like to happen today? And then finishing off, kind of summarizing the information we've got, and then asking them, do they have any further questions, or is there anything else they would like to tell us? All right, team, easy peasy lemon squeezy. So we don't have to be stuck with just using sample. We can expand our history taking out and our subjective and objective assessment using our modified 4 frames. Okay, team, happy studying.